Hey everybody, this is Grace, and pardon the way I'm doing the video, but you know, if you look at this long enough, this brick wall, it'll look like the middle is coming in and out. It's like an optical illusion. Anyway, in this video, I'm going to talk about my adrenal disorder. It's going to take videos, several, to talk about it, but the reason I'm talking about it now is because I wound up in the hospital on Saturday, July 3rd. Today is Monday, July 5th. And the whole thing, one of the good things about it was that they wound up doing a CT and confirming, which something that has not been confirmed since 2004. It was 2000 and then 2004 that I have this adrenal disorder. I'm going to go all into another video about all the doctors I've seen since 2004, and even the one in 2004. And even the one in 2000, how they wanted to deny it so strongly that I had it, even though they had the CT results in front of them. Okay. The first one, she didn't want to deny it. It was when she was angry. And that's a whole story into itself, believe me. The other one, wow, I don't know. But anyway, it's called, and I have not heard it pronounced, so I'm probably going to mispronounce it. I'm not a healthcare professional, so I don't know. I'm just telling the story. It's called adrenal, I would say myelolipoma. It's one word, myelolipoma. I think that's how they would pronounce it. Like I said, I could be wrong. And, but anyway, the reason I wound up, I wrote it down in case you heard that paper moving. The reason I wound up in the hospital ER on Saturday. Yeah, Saturday. Boy, this 3-day weekend screwed me up on what day, everything as usual. But I wound up because remember he's more of a dog now. But when he was a puppy, I nicknamed him Mayhem because from day one that we got him, he was, oh my goodness, he caused so much trouble. He's just full of mayhem. And I remember the funniest thing we thought was the first day, and I think it was right after he did that, I called him Mayhem. But this one was just kind of funny, was that the only other dog that we had to put him down was eventually because he had a stomach cancer, but that was Marmaduke. And Marmaduke was laying on his bed. Marmaduke never took to him. He kind of taught him some things, but never really took to him, the puppy. And, the puppy just started barking at him. Like he was the alpha male, and Marmaduke better realize it. Well, Marmaduke was an alpha male. Just an old alpha male with dementia. Okay, and like I said, stomach cancer. But, when we found him, he was somewhat of a rescue when we found the original owners, who were they had moved from Tennessee to Texas with the mama and her puppies, which Mayhem was one of them. When we met him, they said that they told us how old he was would be around from October 15, around October 15, mid-October, they said. And he was a month and a half when we got him. He was taken way too early from his mom, in my view. But he hadn't learned things, and he still is not learning things right. But anyway, they told us that the guy said he was the leader of the pack. Well, yeah, alpha male. And I never put much stock into that alpha male thing. But anyway, pardon me, I've got these allergies, so. Okay, I'm going to try to stop from doing that, but wish me luck. Anyway, and I'll lose my voice, probably. It's already starting. But, anyway, Saturday, Adam was going to take Mayhem out the front door, okay? He had to go out in the front and, walk around a little bit. Now, our dogs have always that's the biggest thing in their life, is to be able to go out front. They have a whole backyard, but they love going out the front. Okay, that's just their thing. And Mayhem was no exception to it. He just loves it. Well, apparently to him it seemed like that I was stopping the process from Adam doing that. And that's what Adam and I said at that moment. But what Mayhem did was he jumped up, put his, really hard pushed me. Okay, pushed me and kind of pushed down with his claws, But really, and right after that happened, I was telling Adam, that's not right, And I wouldn't let him go up front because Adam wanted to, and I said, no, you don't. He said, yeah, we don't reward bad behavior. Anyway, that side of my stomach and my abdomen, on the left side, he had kind of, like I said, pushed it and pushed down. Well, some of this stuff is going to sound gross, so if you get grossed out easily, don't watch. Don't listen, that is. But it was like, if you put one finger on top of another one, it was about that high up, about that thick. Not everybody's fingers are the same, but you see what I'm saying. And it was blue, like a vein. It scared the crap out of me, so I went to the hospital immediately. My blood pressure, when I got there, they tested it immediately. I don't know why they didn't do that before, but right there, standing there, filling out the paper, they tested my blood pressure. What triggered them to do that? I don't know. They had to go, the woman had to go in the back and come in the front and test it, and it was sky high. Okay, I mean 250 or 69, somewhere around there. The bottom was 170 something. That's high. That's bad. Mine is usually low, a little bit on the low side, like 100, say 100, 105 over, say, around 60. So they put me in a room. Now they have rooms instead of just, those little curtains practically. But they put me in a room, and an ER room. And the woman tried to test my blood pressure again, because I guess she couldn't believe it. And it made my left hand turn so red. I pulled it off. I said, no. And she was kind of snappy. I never saw her again. And she said, they were all young, by the way. And no, not saying anything bad about young, but they were all young. It was very obvious. And new, to me that means that they're new to their job. They are new if they're young, really young. So anyway, she kind of snapped at me. She said, well, we're going to have to know if it's true or not to determine what we're going to do. I said, well, just wait a little bit. Let me calm down. Well, she never came back. It was kind of obvious with her. But not all of them. But, we're this type. So anyway, they all, when each one, they don't introduce themselves. So what happened to people introducing what their position is there? Like, I am the I am the person who does that. Or I am the nurse, I am the PA, because I had both a nurse and a PA apparently. And, of course they wear it on their whatever, some little thing, but you can't really see it, So if somebody just comes in and starts doing something, I'd like to know what they're doing. I'd like to know who they are. But apparently they don't do that anymore. I have not seen that in a long time. So anyway, I would just show each one of us, are you someone who needs to see it? Seriously. And they didn't even put me in one of those, whatever they are. I was just wearing my clothes. I had on capris and a shirt, some shirt. And anyway, by that time it had the swelling of it. I said, it swelled up right then, like that. And I told him, that just doesn't happen to me. And I don't bruise that easily, that quickly. It usually don't. It usually takes a day or so, or at least the rest of the day. But you know what I'm saying. Anyway, so it was starting to look a little more like a bruise. And believe me, at this moment, it looks horrible. It is big, and it is so black and blue, bruised. But anyway, I started telling them, that they go through all that stuff and all this, and I told them about my adrenal disorder. Okay, and I am telling you, I've known this since 2000. Okay, the year 2000. Okay, this is 2021. I've known it all this time. And every time since that first set of little doctors, that when I would say that, go in there, they'd like, I mean, you could see the They wouldn't say, like, right. But it was so obvious. One of my doctors, their office, I kept requesting them to get those results, and they wouldn't do it. It was like they had made up their narcissistic, pardon me. That's how I see it. It's narcissistic, not the personality disorder, but the behavior. Is they've made up their mind what's going on before having the facts. That's not good for doctors to do at all. Doctors, healthcare professionals should not do it at all. Okay, to make assumptions and go on their assumptions when the patient is actually saying this is the case. I've had professionals, radiologists, that do the CTs, and the ones who read it and determine what it is, and doctors and endocrinologists who state that, but no, they want to say that they know better. One of them actually did say that no, I think it's this. Well, personally, you're just a PCP, personal care physician. You're not an endocrinologist. You're not the radiologist. The arrogance, I'm telling you, and I've said this before, and I'll say it again. Where I live, it's known for people to be rather narcissistic. I did not give it the reputation. When I first heard of this area, they said it was the whole city, but it's not. It's more like areas. But in my experience, I'm a social and behavioral scientist, but when I first heard of this place around 30 years ago, what I heard was basically that it's very narcissistic people live here. Okay, Adam told me the other day he heard this is one of the top, I don't remember which one it was, but the top in the nation. I know our actual neighborhood is in the top of, I think it was the top or something like that in Texas. Okay, I'm not bragging, it's just fact, and that could, I'm not going to stereotype people who are wealthy, because it's very wealthy. That was what it was. It's a very wealthy city. Well, it's a suburb of Dallas. The show Dallas, the South Fork Ranch is like 5 miles from here. But it's very, but it is a lot of people with attitudes. Go look at my videos. Now, me, I'm not like that. And yeah, it's social and behavioral sciences, but I see it is so thick. But not everybody, of course. Not everybody. But anyway, so the arrogance I see in doctors, nurses, not all of them, like I said, none of this is all, but you can see it. I can see it. And even stores, convenience stores, anything, there's a rather bit of arrogance. Doctors should not be making, like I said, assumptions based on their arrogance. Okay, let's see. Okay, let me get to this. So, this has been a problem for me. This with they know better than the past one, the endocrinologist, okay? And there was internal medicine too. There were all of them. They said, yeah, it's obvious, it's right here, but no, like that one. No, well, I think it's more of this. Like I said, she was just a PCP. Okay, she was not one of them who knows what they're talking about. And I got I had a copy, who knows whatever happened to that. Was 2004, I got the copy. And like I said, doctors since then, and I don't live in Texas. Most of the time I hadn't had health insurance. And, I'm not of that attitude that that the government had of they're not going to have people getting that, and with the whole thing with the Affordable Care Act, no. I think we should all have had an opportunity to get it. What is out there now, oh my goodness, and this wasn't the first year, last year, whenever by the first, it is ridiculous. The amount that they want people to pay, and the amount of the deductible is sky high, and the out-of-pocket deductible, both of them sky high. Oh my goodness, that's horrible. Is this third world they trying to be. But anyway, I got more to say on that. But anyway, where was I going with this that part? Oh boy, it's early morning. I haven't had my caffeine, so okay. So I'm going to go back to actually in the ER. I mentioned this, like all these doctors and nurses and healthcare professionals are like, because there is this thing, and I don't remember where I heard it more than once, how many times, whatever, that I'm a tall woman, okay, and overweight, and as it is with this, as I was told then, I will always be overweight because I cannot lose weight. And what they tell me in 2000 and 2004 is, 2004 they say is inoperable, so they can't change it, that I just had to basically use the Band-Aid medications, which are only for what it causes, diabetes, or causes, or I think it's caused, but like I said, I'm not a healthcare professional. Diabetes, hypertension, and I actually read a while ago something about low potassium, which kind of surprised me, and cholesterol that's screwed up. but anyway, I haven't read enough current on it. What I had read was in the past, because like I said, these doctors and healthcare professionals, they're not going to take it past there. They're not going to, they're going to tell me things like, well, all you have to do to lose that weight is diet and exercise. No, it will never happen. Okay, it will not happen by just diet and exercise. Okay, but they don't want to hear that. What they want to hear is they have already, and it's quite a bit of a prejudice, if you ask me, social and behavioral scientist. My master's degree is in sociology. I taught at college and university. Okay, now I do know more than they. Well, if they don't have the degrees, I do know more about this. But this prejudice, I see it as a prejudice. And, they have, because of that whole, stereotype of women who are overweight, that some of them, they'll come and say, well, I have an adrenal disorder. And when they don't, so it's just, so they don't, the whole attitude is so they don't have to push themselves away from the table, that they don't have to monitor their diet, blah, 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 blah. Well, guess what? I am not one of those. I have an adrenal disorder. But because of their prejudice and because of them acting on, they probably have heard this a lot, or maybe they have heard this from a lot of people. They're just going, and I did have the feeling that Saturday when I was in the hospital, that they wanted to do this CT because they, of some kind of smart aleck attitude. I'm probably wrong on that, but one of them kept saying things to me, and I was like, why is she saying that? It was, I don't know, I think her position was that she was just an ER nurse. Or, I don't know, like I said, since when did they stop introducing themselves? It's really hard to see their badge, that's what it is. Whenever they're moving all around and all that, introduce yourself, okay? And your title, your position on there. Anyway, she kept saying that, and she'd look at me, everybody's wearing masks, but she'd look at me with a kind of like, her eyes, like she'd do her eyes a little funny, like, like that. Well, when the actual PA, she came in, she said, oh, and we did see that, yeah, you do have this adrenal disorder. And she acted like she was, she had been guilty of something. The whole act, social and behavioral scientist. I was a career student too. Her whole way, her whole demeanor and everything was like she was a kid who was caught, she was somebody who was caught in it, what she was doing, what would have been, the whole scene was that they were doubting me. Okay, this was not my first rodeo with this, 20 years of it. Okay, so, and consistently, like I said, one doctor's office refused to get the the results because they believed what they believed. what they felt instead of what they know. Facts. You should know facts, not your belief, what you just want to believe, because you are rather arrogant, and you summed it up when you saw me, and you don't want to move from there. You don't want to be wrong. Remember, I have a channel. All I do is talk about narcissistic behaviors, toxic people, cluster B behaviors. I have a clue. Yeah, I have a big clue. So anyway, I have a whole lot more to say about this, and but now what I had heard, it was really weird. The timing of this was just, I don't know, maybe not even a week before. I was in the hospital Saturday. Not even a week before then, I had run across something online that said that they treat this with medication. They didn't treat it with medication back then. Okay? No. It was, you deal with it. And I've tried to find out, I want to do some more research. I saw that there was one, and, I'm going to be following up. Today is, people are off, the 3-day weekend. But tomorrow, Tuesday, July 6th, I'm going to follow up with my new doctor. Okay, yet another one. I have not even met in person because of this, what's going on. It was always telemed. And I'm going to say I need to actually see the doctor, because they'll give you PAs and, no, I want to actually see the doctor. And I'm going to talk to her about that. And they said that they actually told me in the hospital to follow up with my doctor, and that they would refer me to somebody. Okay. And I'm going to do that. Plus, I asked that one that kept being like doing her eyes thing, about me taking the, getting the shot to the arm. And even though I told her I thought I already had it last year, well, she said, I told her, I said, I don't even know if I can do it because of this adrenal, issue. And she said, why? A shot is a shot. Okay, that's not very professional. So I'm going to talk to the doctor. I had already planned on it. That was what's weird, was I'd heard this before I wound up in the hospital. And I was thinking, they're going to tell me to go and get a CT. Well, guess what? Now I already have one. And it was all because of, thanks to me. Really, that I had this CT because they wanted to do it. I think they really wanted to prove and say, you're one of these people. Just because, like I said, that woman said she was just, something wasn't right about what she was saying. Yeah, and one part was, well, it's really just up to you if you want to do it. The actual PA was saying, we're going to do this because you seem like you have a lot of things going on. Then the actual PA is the one, she seemed like she got caught. And what I think is she got caught in her prejudice. How she was being prejudiced. You see what I'm saying? Enough for this for now. I'll talk to you on another video.